just jump directly into the session in I see the interest declining drastically. So whatever would be that we will do the next 20 to 25 minutes.
Interest is the decline for others.
Number of people.
So let us take it first.
Yes. So firstly, like last time we spoke, let's do some deep breathing 10 times. Breathe in through your nose and breathe out slowly. Inhale forcefully and exhale slowly. Inhale, exhale. Inhale energy and exhale everything negative inside. Inhale, exhale. 5 more times. Inhale, exhale. Inhale and exhale. Inhale and exhale. Let's do some warm up. On the spot, let's walk. 10, 9, 8, let's swing around. 7, 6, 5, 4, 3, 2, and 1. Now lift your arm like a L. Rotate up and down. Rotate up and down. Rotate up and down, up, down, up, down, up, down, up and down. Let's swing our arm all the way up. Try to go down as much as you can. And up, down, up, down, up, down, up, down, up, and down. Let's get back to the normal position. Let's do some side walking. 2 steps to your left, 2 steps to your right, to the left, to the 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 right, and forward. Side lunges, keep your legs wide. All of you to your left, go down a little bit, the other knee straight. And up, 2, 3, 4, and 5. To the other side, toes pointed outwards. 1, 2, 3, 4, and 5. Now let's do the regular squats. Your comfort. Straight. Push your hip behind and go down like 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now keep your hands on the hip. Push your leg backward with the knees straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Repeat again on your left side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. The other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. 30 seconds break. Breathe a little bit. Start the next one. Keep your legs wide. Bend down. Touch the floor as much as you can. Okay? Now move your right arm towards your left leg. Left arm towards your right. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7. 8, 8, 9, 9, 10, and 10. Enough? All of you on your knees. Baby crawling position. Move your hands a little forward. Go down as much as you can and come up. No compulsion to go down fully. எவ்வளோ முடியுதோ அவ்வளோ கொஞ்சம் கீழே போயிட்டு மேலே வாங்க. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Enough? 30 seconds break. This is a very basic exercise where any human being should be able to push his body up. This shows your fitness level. Okay, well, it's considered that a person who can do 25 push-ups at a stretch is completely healthy. Okay, well, so this is one. இப்போ அந்த push-ups வச்சு first ஒரு 4 rotation நம்ம பண்ணது எல்லாமே we were doing lower body centric. Now we will do little bit of upper body, again go for lower body. அதே மாதிரி position வரலாம். வந்துட்டு try to stand in your feet making an inverted U. புரியுதா?
புரியுது.
Yes?
Yes.
Now go straight and inverted V. 2. Straight, inverted V. Straight, inverted V. Straight, inverted V. Straight, inverted V. Straight, relax. Thirty seconds break. If you guys want to sip some water, you can. Workout பண்ணும்போது தண்ணி குடிக்க கூடாதுன்னா எதுவுமே கிடையாது. If you drink too much, there will be a reflex. But workout பண்ணும்போது you lose a lot of water. So keep sipping whenever, wherever you are working out. Last time செஞ்சதே இன்னொரு செட் செய்யலாமா? Straight, inverted V, down, inverted V, down, inverted V, down, again, number 4, down, number 5, down, number 6, down, number 7, down, number 8, down, number 9, down, number 10, and down. Good? Let's get up. இப்போ ஃபர்ஸ்ட் புஷ்அப்ஸ் பண்ணும்போது நம்ம ஃப்ரண்ட் சைடில் இருக்கிற செஸ்ட்டை கொஞ்சம் கோர் உங்களோட ட்ரைசப்ஸ் அண்ட் ஷோல்டர் ஒர்க் பண்ணோம். when you are going up like inverted V, உங்கள் முதுகையும் சேர்த்து ஒர்க் அவுட் பண்ணணும். ஓகேவா? நெக்ஸ்ட் ஒன் ஸ்டாட்டிக் ஹோல்ட்ஸ். ஒரு கால் லிஃப்ட் பண்ணிட்டு whichever way you are comfortable, இடத்துல கை வச்சுக்கோங்க, சைடுல கை வச்சுக்கோங்க, முன்னாடி கை வச்சுக்கோங்க, it's okay. Lift your right leg, hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Change. Left leg up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Change. Right. Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Change. Left. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Enough. இப்போ எல்லாரும் அப்படியே ஒரு லைனா வந்து உங்களுக்கு ஃபுல்லாக சப்போர்ட் ஆகும். You want to go, you can go. Yeah. என்ன பண்ண போறோம் அப்படின்னா, your back is on the wall. வச்சுட்டு கொஞ்சம் கொஞ்சமா கீழே வந்து உங்களோட கம்ஃபர்டபுள் பொசிஷன்ல உட்கார போறீங்க. யார் நிறைய நேரம் உட்காருவீங்க அப்படின்னு பார்க்கலாம். ஃபர்ஸ்ட் சேலஞ்ச் வால் சிட்ஸ். லெட்ஸ் சிட்.
கால் முன்னாடி
ஆமா சார், கொஞ்சம் கால் முன்னாடி வச்சுக்கோங்க, உட்காருங்க. எப்படி வேணா, வாட் எவர் வே யூ ஆர் கம்ஃபர்டபுள். லெட்ஸ் ஸ்டார்ட். 10 உட்காரலாம். 9, 8, 7, 6, 5, 4, 3. யாராவது விட வரைக்கும் நம்ம கண்டினியூ பண்ணுவோம். லெட்ஸ் see who falls first. 1, 2, 3, 4, 5, 6. கடைசியில் நீங்க சீட் பண்ணுவீங்க, ஜாலியா உட்கார்ந்துருக்கீங்க. 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3. உடம்புக்குள்ள வைப்ரேஷன் எல்லாம் தெரியுதா? 2, 1. enough all of you get up. Okay, so usually when we are working out, நம்ம பாடியில இருக்கிறதுலயே லார்ஜ் மசில் குரூப்ஸ் அப்படின்னா நம்ம இடுப்பு கீழே இருக்கிற மசில் குரூப்ஸ். ஸோ இதை நம்ம எப்போலாம் யூஸ் பண்ணுறோமோ அப்போ நம்ம ஒர்க் அவுட்டோட அவுட்புட் நிறையா இருக்கும். அதனால தான் அப்பர் பாடி செய்யும்போது டயர்ட் ஆகிற மாதிரி இருக்கும், பட் யூ ரிகவர் இமீடியட்லி. பட் லோவர் பாடி செஞ்சீங்க அப்படின்னா அடுத்து ஒரு 5 நிமிஷம் உள்ள ஒரு வைப்ரேஷன் தெரியும். லெட்ஸ் டூ இட் ஒன் மோர் டைம். அதுதான் இவ்வளோ பேசுகிறேன். Let's start. 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20. This is where I forget math. 25, 24, 23, 22, 21, 20, 19, 18. Back full of 17, 16, 15, 14, 13, 12, 11, 10, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8. Last man standing up, last woman standing up. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, maximum 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 1, 2, 3, 4 பேர் இருக்காங்க. 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16. 100 இல்லைங்களாமா? Yes. 100, 99, 98, 97, 96, 95, 94, 93, 92, 91, 90, 39, 34, 31, 105, 102, 101. சரி நம்ம பேசிக்கலாம் யார் வர்றாங்கன்னு பார்க்கலாம். So two more. So see, when it comes to fitness, group A work ஆகுது அப்படின்னா you now have not just work, ஒரு challenge அப்படின்னு வரும்போது you find it more interesting. நம்ம கஷ்டப்படுறோமா, பக்கத்து வீட்லயும் கஷ்டப்படுறாங்களா, அப்பா சந்தோஷம், அந்த சென்ஸாவும் எடுத்துக்கலாம். இந்த செகண்ட் திங் குரூப்பா ஒர்க் அவுட் பண்ணும்போது ஒரு நாள் நீங்க ஒரு 2 பேர் சேர்ந்து ஒர்க் அவுட் பண்றீங்கன்னா நீங்க வரல அப்படின்னா you become accountable to the next person. அப்படி இல்லாம தனியா ஒர்க் அவுட் பண்ணும்போது ஒரு வீட்டில் வந்து நான் என் பெட்ரூம்லேயே ஒர்க் அவுட் பண்ணிக்கிறேன் போது that sense of accountability and pushing each other அப்படின்றது இல்லாததுனால தான் நிறைய பேரோட ஃபிட்னஸ் ஜர்னி வந்து ரொம்ப சீக்கிரம் ஸ்டாப் ஆகும். So when you want to travel in the fitness, first thing accountability, second thing you need a dedicated space. Dedicated space na ipo na வந்து என் பெட்ரூம்ல ஒர்க் அவுட் பண்றேன் அப்படின்னா என் மாமியார் ஊர்ல இருந்து வந்தாங்க அப்படின்னா நான் ஒர்க் அவுட் பண்றேன்னு சொல்ல முடியாது. போய் அவங்க வாங்க அப்படின்னு கூப்பிட்டு தான் ஆகணும். அப்போ my workout is gone. But if you find a dedicated place, then it becomes very very easy for you to work out. எங்க வீட்டுக்காரர் ஒர்க் அவுட் முடிச்சுட்டு வந்துடுவாரு அப்படின்னு அவங்க அம்மாவை சொல்லிட்டு உட்கார வச்சுருவாங்க. வீட்டுக்கு போயிட்டு மாமியாரோட நம்ம பஜ்ஜி போட்டா சாப்பிடுவோம். ஸோ டூ மோர். எஸ், ரெண்டு பேரும் செட்டில் ஆகிட்டீங்களா? ஓகே. ஸோ கிரேட். Okay, so let's come back to position. ரொம்ப நேரம் உட்காரும்போது you had a burning sensation in your legs. That is lactic acid buildup. இப்போ உங்களோட மசில் வந்து அது யூஸ்வலா பண்றதை விட ஜாஸ்தி வேலை செய்யுது அப்படின்னா it is the mechanism of the body telling போதும் நிறுத்திக்கோ, நம்ம கம்ஃபர்ட் ஜோனை தாண்டுறோம் அப்படின்னு. That is why you have the lactic acid buildup and the pain அப்படின்றது வருது. பட் நீங்கள் ரெகுலராக பண்ண இப்போ 10 செகண்டில் வரது வந்து ஒரு ரெகுலராக பண்ண your muscles will get stronger. 15 செகண்டில் வரும், 20 செகண்ட்ஸில் வரும். That's how you progressively become fitter and fitter. So அடுத்த செஷனுக்கு வந்து வெயிட் பண்ணிட்டு இருக்காங்க. So let's just do some 30 counts of walking and call it off and attend the next session. அந்த செஷன் முடிச்சதுக்கு அப்புறமா நம்மளோட ரிப்பீட் செஷன் வரும்போது whatever questions you have in terms of your fitness and nutrition, we will answer. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Great guys.
Dr. Arun for Orthopedic surgeon. Dr. Arun is well-known orthopedic surgeon in Chennai, specialist in orthopedics, advanced pelvic and abdominal trauma, joint replacement surgery, orthoscopic surgery, minimal invasive ultrasound guided interventions in currently practice at Chennai Urology Robotics Private Limited. Dr. Arun's undergraduation from one of the premier institutions in the country, Madras Medical College, and his orthopedic postgraduate from the Amrita Medical College. Saw him progress successfully into his medical profession as a junior consultant Medical Trust Hospital, Kochi. He is further on pursued fellowship in pelvic and abdominal trauma from Max Super Specialty Hospital, Murali, under the guidance from Dr. Kumar. He contributed upgraded skills following a fellowship in joint replacement and the orthoscopic from the International Society of Orthoscopic Knee Surgery, Orthopedics Course, Medicine, Arun Center. His passion and special interest in the abdominal trauma and joint preservation has led him to successfully examine, diagnose, treat and perform many successful surgery in the areas. He is an active member of Indian Orthopedic Association, Association of Pelvic Abdominal Surgeons, India Orthopedic Society, Tamil Nadu Orthopedic Association and AO Trauma Foundation. We are invited Chennai Urology Robotics Institute Private Limited.
So why I have chosen this topic in wellness program is there are diseases generally classified communicable and non-communicable, and osteoporosis is one of the commonly seen non-communicable disease, which means related to the sedentary lifestyle. Okay, so it's very common not only in the females, irrespective of the female or male gender. It is very commonly seen nowadays due to the sedentary lifestyle. So that's why I have chosen this topic. I'll give a quick review about this topic, okay, which has to be few things has to know for about this disease. Yeah, that's what I asked in the beginning itself.
No, you can sit down. That's the issue.
No, that's something.
Not easy.
Because I didn't know what is your routine here. நீங்கள் தான் இன்ஸ்ட்ரக்ட் கொடுத்துருக்கீங்களா டு ஸ்டாண்ட்
ஒர்க் அவுட் கொடுக்கும்போது நின்றுட்டு இருந்தாங்க.
Okay, I think you guys are doing exercise for a long time. Yeah. So, objectives of my topic is everybody at the end of this talk, everybody should know what is osteoporosis and what are the risk factors which predispose this disease process, and what are the clinical features, means symptoms you will feel when you get this osteoporosis, and how to prevent, and few topics related to the treatment. So I am going to concentrate more on the prevention and risk factors and the clinical features. Okay, so which is essential before the disease process starts. If you do some activities and if you take some measures, then you can educate your friends and you can also change some lifestyle changes to prevent this disease. Okay. Before starting, I want to give a brief introduction about anatomy of our bone. Anatomy means the structure, how our body is formed. Okay. In general, bone has two parts. Cancellous bone. This cancellous area is mainly made up of multiple trabeculae like this. Okay, you have to remember this picture. So during our development, because from the childhood, from the neonate, as soon as the newborn baby born, then at the age of 1 year they used to stand. On the first birthday used to stand and then keep walking. So the muscle get activated. Okay, once the muscle get activated, our muscles are origin from one side. I mean, it start from one area and attaches to one area. There will be a constant contraction. Okay, so the constant contraction evenly distributes throughout the body, and this rough architecture is developing. You can see this. We call it this trabeculae and are arranged in a one particular direction based on our muscle arrangement and the muscle pull. So that's why we are asking to do exercise and make them more work. So if you don't do any exercise, any sort of exercise in the first 30 years of age, and your bone development is very less, then you will very fastly develop osteoporosis, I mean bone weakness in the later part. Okay. So this is the thick cortical bone and this spongy bone called trabeculae. And if you take a microanatomy, if you just divide again if you go inside, there are numerous this round structures called osteon. For any for bone, this is the basic bone forming unit. We call it as osteon. For anything, we have a basic structure. Like if any chemical, we have a basic molecule like that. Our bone, the bone forming structure is called osteon. Lamellae. Okay, then thick periosteum. So if you cut your bone in a cut section, you can see this type of microarchitecture in bone. Okay, so osteon is our main bone forming unit. Then two more cells, osteoblast and osteoclast. Osteo means, I already told you, it's a bone forming unit. Blast means it is bone formation, and clast means bone resorption. These two terminologies you should be aware of it. Okay, osteoblast and osteoclast. These two cells, osteoblast is responsible for bone formation and osteoclast is responsible for bone resorption. Okay. So mainly osteoporosis develops because of the imbalance between these two cells. So what is osteoporosis? It is a Greek word. I think most of you know about that most of our terminologies are derived from Greek. So osteon means bone and poros is a pores. The trabeculae has a pore. That porosity will be increasing with the disease process. Okay, when the osteoclast eats our bone, then this porous structure, this microarchitecture. From this is, for example, this is the normal one, and when the osteoclast activity is more, it will become first the stage is osteopenia, the mild form of bone loss. Then it will go for a severe osteoporosis. For this, we do the one test called DEXA, dual energy X-ray absorptiometry. Okay, when we suspect they have some kind of osteoporosis, we do this DEXA scan to know our bone mineral density, BMD. Okay, and we take this from our spine and both the hip proximal bones. Okay, this area is called hip. This is a femur bone, thigh bone. So we measure from thigh bone and our spine, and we calculate the bone mineral density. If the bone mineral density score is between -1 to -2.5, where anything less than -1.5, it is a normal. Okay, you can see consider this, our bone is normal in density. If anything between -1 to -2.5, we call it as osteopenia, the beginning of osteoporosis. If anything less than -2.5, and we call it as osteoporosis. If they have a -2.5, less than -2.5 with any fracture, it is called severe osteoporosis. Okay. Why I say the fracture, will come to that later. So, whenever you go to the doctor, sometimes they will advise do the DEXA scan. Okay, the reason is to know how much is your bone mineral density. Okay, based on the density only we decide whether you are having osteoporosis or osteopenia or severe osteoporosis. Then other associated clinical features like other comorbidities like diabetes, hypertension, or any other pre-cancerous condition, and hypothyroidism or hyperthyroidism. So based on other clinical features you have and this severity of osteoporosis, then we decide the treatment plan. Whether you need only lifestyle modification or you need any drugs in the form of tablets or injections, we decide based on this score. And we follow up also once in 6 months, we repeat this test whether the treatment is effective or we have to change our treatment algorithm. Okay. So DEXA scan, dual energy X-ray absorptiometry, is a scan which we use to measure the bone mineral density. Okay. So the risk factors, in general, if any disease process is concerned, we broadly classify the disease risk factors into the non-modifiable and modifiable risk factors. Non-modifiable, as the name suggests, we don't have any control over it. For example, our age and sex and our any genetic variation. Okay, so these are all things we don't have any control over it. Aging process as well as gender and genetic variation. And any pre-existing illness which is developed already in our body. These are all non-modifiable risk factors. But there are a lot of risk factors which can be modified. The most common thing nowadays is smoking and alcoholism. Okay, so these are if you are a chronic smoker and a chronic alcoholic, you are 20 times more prone to develop osteoporosis rather than those who are not taking or rather than non-alcoholic or non-smoker. Okay, this is the most commonly seen a risk factor which is easily avoidable. Okay, then medication, certain medication like steroids. The steroids we have to balance. Steroid is a double-edged sword, we call it as, because many patients who are having a rheumatoid disease or any other form of chronic renal problems, we used to tend to give steroids. So steroids, if you have to take it in a proper dose in a tapered manner. If you are without a proper prescription, if you are taking chronically, the steroids drugs will inhibit the osteoblast and it increase the osteoclast formation. Okay. Finally, it will lead to bone weakening, that osteoporosis. Second, food habits. If you are not including calcium containing foods in your regular diet habit, then that is also another risk factor. Then sedentary lifestyle. If you are not doing any exercise and if you are not participating in regular activities, then, and like I said, the muscle contracts that in particular pattern, the trabeculae is not formed properly. That is not immediate effect, but over a period of time. The evidence shows if a person doesn't do any form of physical activity less than 30 years of age, they are more prone to develop osteoporosis compared to the randomized controlled trials which is shown like this. Okay. Then I think I have, you can see that mnemonic, alcohol use, corticosteroid drugs and low calcium and estrogen low. That is post-menopausal. Till the regular periods, you will have a balanced hormone level between the estrogen and progesterone. These are the two female hormones. Okay. Post-menopausal stage, estrogen levels will be low. So that when that hormone comes down, the calcium levels also will be low. So they will more prone to develop osteoporosis, females compared to that. Then smoking and sedentary lifestyle. So I already told there are two cells, osteoblast and osteoclast. Osteoblast is responsible for bone formation and osteoclast is for bone resorption. Okay. So we have to balance between these two cells. Bone has to be, whatever the bone is formed, it has to be resorbed and new bone again has to form. Okay. For example, when we the roads are again they are removing and they are carving right again. So similarly, whichever bone is formed in the childhood period, there is continuous activity. When it becomes areas weak, the osteoclast don't act in this area and remove the old bone which is damaged, and the new bone will keep forming. So it is a balance between the osteoblast and osteoclast. So certain disease process, for example, hyperparathyroidism and the drugs which I said. So these are the drugs will reduce the osteoclast activity and increase the osteoclast formation, finally leading to osteoporosis. If you call it technically, it is a secondary osteoporosis we call it. One is post-menopausal osteoporosis, and what is the etiology? We will call additional to that term is osteoporosis. So this is another example. The first picture depicts how the normal trabeculae, how tough our bones are. Okay. Then second, it's osteopenia. I told when the bone mineral density between a -1 to -2.5. This is how it will look our bone. When it goes less than -2.5, this is how our trabeculae will be. The pattern will be there, but the strength it won't be there. Okay. If you just press, it will collapse. That's why we call it as a fragility fractures. Then what are the clinical features? So most of the patients will present with the trivial fall. It's not a very significant fall, trivial fall, and they will sustain the fracture. For example, these are the three common fractures we encounter in osteoporotic person. Okay, when they fall at outstretched hand, this is called radius and ulna. So this bone will fracture common, and when they slip and fall in a slippery bathroom or something, just slip. And usually the common history is they will go to the toilets in the midnight because they will have a frequent micturition. When they are old age people, they will have a frequent micturition. So when they go to the toilet, either without a light or a slippery surface, they slip and the hip bone will be fractured like this. Then third common, if they fall on the shoulder, then again this proximal humerus will get fractured. So these are the three areas: distal radius and proximal humerus and proximal femur. Our bone mineral density will be going very fast in these areas. Other areas are tubular bones. It takes some more time. Okay. So these three fractures we encounter in an osteoporotic fracture. We call it as a fragility fracture. Means the energy is very less to produce this fracture. They just slip and fall, and this kind of major fractures will happen. So we call it as osteoporosis induced fragility fractures. Then compression fracture in the vertebra. For example, they slip and fell down with the back, lower back, but they will start with a mild pain. initially. They don't have any significant pain. After that, over a period of time, it starts compressing with each movement, because spinal column is not a stiff bone. It is formed by intervertebral disc. How our bike and car have a shock absorber. No? Similarly, our spinal column is stacked between this small shock absorbers. Okay. So along with that, multiple ligaments also we have, multiple ligaments and muscles to keep our spine straight. Okay. The spine also is not a very straight one, it has a curvature. In the neck region we have a small curve, then thorax and again lumbar spine. We have 4 curves in our spine. This has to be maintained for a normal movements. Okay. But when the density, bone mineral density is reduced, even in a small trauma or even normally, the vertebra starts collapsing. Okay, even if you don't have any fall or any trauma activity. Once I showed you the third structure, when it reaches this third area, it automatically starts collapsing and the height starts reducing. So when the height starts reducing, then there will be a forward bending, we call it as a kyphosis. When it is side bending, we call it as a scoliosis. That won't happen in osteoporosis. But it will go for a forward bending. If you, nowadays it's very not common, but if you see the old epic drawings and all, they will have many people walking for a kyphotic structure with walking with a small walking sticks. So the main reason is the vertebral height starts reducing gradually over a period of time. Okay. So this is spine, but non-specific back pain and other joint pains. Okay. Most of the times when you evaluate, all the findings will be normal except this calcium and vitamin D3 and X-ray finding. So you will have a very non-specific generalized body pain. So how to prevent? I already told the risk factors. So we have a control over the modifiable risk factors. We don't have any control over the non-modifiable. But modifiable risk factors, we have a control. We have to have adequate calcium intake in our food. Either you are vegetarian or non-vegetarian. You have to have a regular calcium intake in your food. For example, milk products like I think all are vegetarians here. Anybody in non-veg? Okay. So you have to have regular calcium intake also in your diet. Okay. Then vitamin D. This vitamin D as a calcium supplement and vitamin D3 is commonly prescribed those who are in the already risk area. Okay. Vitamin D, either we can get it in the sunlight. Okay. Either 20 minutes of sunlight exposure every day, it will improve our vitamin D levels. Another thing is we can we can take a vitamin D3 once a week for 6 weeks, then followed by every month. And those who are already developed osteoporosis or in the osteopenia stage, they can take a calcium every day, once a day. Okay, most of the times patients will ask doubt like, doctor, if I take a calcium tablet regularly, will I develop any calcium stones? Renal stones in the kidney. So it won't happen. This is myth actually. Okay. So regular calcium. If you are not taking a regular calcium in your diet, or if you are in an osteopenia stage, or if you are in osteoporosis, you can add calcium and vitamin 3 as a supplement in your and like I said, regular exercise. At least minimum 20 minutes per day. At least 3 to 4 days in a week. I don't know how many hours and days your instructor already told you to do exercise. I advise minimum 20 to 25 minutes if you are in a very busy schedule, you are not able to do for about an hour or I can go to gym or something. Minimum 20 to 25 minutes and 3 to 4 days in a week exercise is must. Okay, you have to make this as a habit. Then you have to prevent a falls, like I said. So this is a very important step. You have to, for example, any other people in your house, visibility, I mean, light should be there. When they go to the slippery areas, light should be there. The slippery areas should be kept very dry. These two steps, if you follow, they have to have some kind of stick or support walking stick. You have to advise this to everybody. If you follow these simple 3 steps, then you will prevent those major fractures. Okay. Once they had a fracture, then their daily routine will be changed. Even if you do surgery and fix, but it is not like a normal, right? Something has implanted in your body. So take a few steps to prevent the fall. Then good nutrition and stop smoking and drinking. Yeah. Then treatment, we have a medication and injection as well as variety of drugs. Mostly we give a calcium and vitamin D, I already told. It can be taken as a prevention as well as a treatment dose based on how much severe your osteoporosis condition. Then we have a few injections called teriparatide. This is anabolic. Okay, it will promote the bone formation. This will be like giving insulin injection. Okay, it has to be taken for 6 months. So these are the then hormonal treatments. So these are the how much bone mineral density you will gain after this treatment and how much percentage will fracture will be reduced with this osteoporosis. Okay, so just to summarize, I want everybody to understand what is osteoporosis. Okay, so it is imbalance between the bone formation and the bone resorption. We measured with the bone mineral density in the form of DEXA scan. Okay, so less than -1 is in danger signal, -2.5 is significantly you have to take a treatment, and you have to follow the preventive measures. Okay, which I already showed. You have to reduce the modifiable risk factors. Okay, and regular exercise, calcium in your diet, and if needed, calcium and vitamin D3 supplementation. Okay. Any doubts?
So a few years back, I met with an accident where my ankle bones have been dislocated, and after that, often when I walk, I'll be walking in a very good posture, but suddenly I trip and fall. I don't know why.
Okay.
Often I get this. Is this because of this osteoporosis or any other things in my joints?
No, it's not osteoporosis. Our any joint is stabilized by multiple ligaments. Okay. If you can't keep any just bones together, right? Just like that, if you can't keep bones. So it has to be stabilized by muscles and ligaments. So ankle also has a ligaments. So when it gets sprained, when it gets mild damage, it's called sprain, and it is fully tear, it's muscle ligament tear. So based on the severity, you have to immobilize the joint for a particular period of time. Then you have to start strengthening your ligaments. If you are not immobilized properly, then it keeps slipping. So it is a ligament injury, not a osteoporosis.
So for 1 month I had that, but after that it was many years back and still I get trip fall.
Because after that you didn't strengthening your muscle that time properly. You have to strengthening that ligaments. So rest followed by strengthening of ligament is important. If you are not done it properly, then these symptoms will recur. Any doubts? Whether I gave too much information in the morning to digest it now?
You get so apt, so you are comfortable.
Yeah, I just prepared only 10 slides. I don't want to stuff with
Yeah, I understand. You are on which side. You have been accumulated over a period of 40 years, 30 years.
நம்ம கவர்மெண்ட்லேருந்து ஏஜ் பை ஏஜ் குரூப்பில் என்னென்ன நியூட்ரிஷன் ரெக்குவயர்மெண்ட்ஸ் இருக்குன்னு சொல்லிட்டு சொல்ல போகிறேன். ஸோ women dietary requirement பார்த்தீங்கன்னா calories வந்துட்டு 1660 kilocalories. ஸோ இது வந்து sedentary lifestyle women தேவைப்படுற calorie. Then moderate women பார்த்தீங்கன்னா 2130 kilocalorie like moderate work பண்ணுறவங்க. Heavy worker பார்த்தீங்கன்னா 2720 kilocalories. ஸோ gluten requirement பார்த்தீங்கன்னா per day 36.6 grams per day. then carbohydrate 100 grams, fat 20 grams, total fat and soluble and insoluble சேர்த்து. Then calcium requirement பார்த்தீங்கன்னா women's தான் ரொம்ப நிறையவே இருக்கும். Normal women பார்த்தீங்கன்னா 800 mg per day. Then iron requirement 15 mg, folate வந்து 180 mg, vitamin D 400 mcg and vitamin B12 2 mcg. So these are the main requirements women's there. So nutrition for girls and childhood and early teens. Childhood lo early teens lo extra nutrients requirements irukke enna particular nutrients irukke paakalam. For bone development pathina mostly teen girls lo childhood lo calcium requirements adhigama irukum. So bone kaga calcium is more important during the teen years because bones that will support for lifetime and being built up. So on the time the bone formation irukum. So calcium requirement adhigama irukadina early teens to childhood. Then most people think of calcium when they think of bone development. Not only calcium, vitamin D ரொம்ப யூஸ் பண்ணுறது அந்த டைமில். ஸோ calcium rich food intake வந்துட்டு childhood early teens ரொம்ப அதிகமாக இருக்கும். So for blood பார்த்தீங்கன்னா iron and vitamin B12, then folate requirement increase ஆகும். Without adequate iron intake, teen girls produces red blood cells. So red blood cells increase பண்ணுறதுக்கு vitamin B12 and folate and iron requirements அந்த டைமில் எக்ஸஸாக இருக்கும். Then அந்த டைமில் வந்துட்டு iron rich foods எல்லாமே கம்மியாக எடுத்துட்டோம்னா ஸோ iron deficiency அனிமியா இருக்கும், ஸோ டிசீசஸ் இருக்கும், ஸோ கான்சன்ட்ரேஷன் இருக்காது ஒர்க் பண்ணும்போது. ஸோ அதனால தேவைப்படுற ரெக்கவர்ஸ் அதிகமாக எடுத்துக்கிற மாதிரி இருக்கும். ஸோ iron most important at early teens and childhood age பார்த்தீங்கன்னா iron requirement, calcium requirement, then vitamin B12, folate requirement அதிகமாக இருக்கும். ஸோ அந்த ரிச் ஃபுட்ஸ் எல்லாமே நம்ம இன்டேக்கோட சேர்த்துக்கிற மாதிரி இருக்கும். சரிங்களா? ஸோ ப்ரோட்டீன் ரெக்குவயர்மெண்ட்ஸும் ஸோ அந்த டைமில் நிறைய எடுத்துக்கணும். ஸோ நான்-வெஜிடேரியன் தோசை இல்லாமல் வெஜிடேரியன் தோசாவும் இருக்கும். ஸோ பிளான்ட் பேஸ்டு பார்த்தீங்கன்னா சோயா ப்ராடக்ட் இருக்கும். தென் நான்-வெஜிடேரியன் தோசில் பார்த்தீங்கன்னா மீட் ரெட் மீட் இல்லாமல் நார்மலாக லீன் மீட் அந்த மாதிரி எடுத்துக்கலாம். ஸோ ஈட்டிங் கரெக்ட்லி இன்னும் 20s and 30s டீனேஜ்க்கு அப்புறமா எப்படி எடுத்துக்கணும். So these are celebrating the nutrient requirements such as age, folic acid, age and particular nutrients பார்த்தீங்கன்னா folic acid, iron, calcium and vitamin D. As I said இதுக்கு முன்னாடி teenage-லயோ early childhood-லயோ எடுத்துக்கிற மாதிரி தான் இதுலையோ. So most requirement பார்த்தீங்கன்னா calcium, iron, vitamin D. So women must be sure that eating enough green vegetables to keep their body ready with sufficient folic acid to prevent the birth defects and babies that comes along with it. So iron needs a higher range of pregnancy and lower reaching menopause. So iron requirements வந்து during menopause ரொம்ப increased ஆகும். So iron rich foods அந்த டைம்ல கன்சியூம் பண்றது ரொம்ப முக்கியம். So sources என்னென்ன sources பார்த்தீங்கன்னா sourcesல so folate source பார்த்தீங்கன்னா dates, green leafy vegetables இருக்கும், legumes, cereals இருக்கும். Then papaya, banana, avocado, citrus fruits எல்லாமே folate rich foods தான். Then iron requirement பார்த்தீங்கன்னா organ meat, drumstick leaves, calcium rich foodsல பார்த்தீங்கன்னா dairy products, green leafy vegetables, millets, orange, dairy finger, almond, etc. இதெல்லாமே calcium rich foods தான். Then vitamin D ல பார்த்தீங்கன்னா cod liver oil, fish, non-vegetarian source இருந்தால் fish oil அதெல்லாமே vitamin D rich foods தான். So mushroom, egg yolk, yogurt, fishes, milk and yogurt எல்லாமே vitamin D rich foods தான். So in 40s and 60s these are menopausal year. Dr. Kumar menopausal year la calcium requirements ரொம்ப அதிகமா இருக்கும். What are the foods we have to include in the age பார்த்தீங்கன்னா most important iron rich foods, same calcium rich foods, then vitamin D, omega 3 fatty acids. So அந்த டைம்ல 40 to 60 டைம்ல பார்த்தீங்கன்னா weight management, weight increased ஆகும். So most of the women la 40 to 60 age la weight increase ஆகும். So because of the body metabolism, so அதுக்கு எப்படி weight loss manage பண்ணணும், so அதோட strategy என்னன்னு பார்க்கலாம். என்னென்ன dietary source ன்றது பார்க்கலாம். iron requirements. So on the stage iron requirements 15 grams per day. So animal source la enna iron red meat, poultry, fishes and shellfishes, egg yolks, idellame animal source iron. So plant based green leafy vegetables ellame keera vagaigal kadellame iron rich na. Then 45 bread and cereals. It was sometimes bread cereals adellame iron 45 panni vechirupanga. So iron content adla seitha adu madri oru product varudhu. Then nuts and seeds, nuts and oil seeds like almond, walnut, then seeds like flax seeds, garlic seeds adellame iron rich usta. Then dry fruits la dates, figs adellame iron rich. Then calcium requirement 800 mg per day. Then sources, calcium rich sources dairy products, whole cereals especially ragi, millets calcium rich arko. So millet based items so green leafy vegetables, nuts and oil seeds, same oils adellame calcium rich. Broccoli is also one of the good sources for calcium. Then vitamin D sources mushrooms, egg yolks, then fortified iron fortification madri vitamin D fortification kodrukku. Cereals, dairy products, soy milks and cereals especially millets also. Fish like tuna, mackerel and salmon are also good source of vitamin D. Omega-3 fatty acids. So omega-3 fatty acids namak good cholesterol improve pannadhu. So HDL level increase pandradha omega-3 fatty acid rich foods la irukku. So mostly omega-3 animal based as well as plant based la kammiya irukku. Animal based enna sollina fish la omega-3 fatty acids content adhigama irukum. So other than plant based la flax seeds, mustard irukum, then canola oil use pannuvom. But mostly increase soya bean madri eduthukalam illa walnut madri eduthukalam. So walnut la cholesterol omega-3 adhigama irukum. So good cholesterol improve pannum. Mustard eduthukalam. Then flax seeds la fiber rich irukum. Then omega-3 fatty acids adhigama irukum. So idellame HDL level la increase pannudhu. Then weight management during 40s and 60s weight increase ago. So weight management roles of estrogen after 40 to 60 estrogen level coming your body la. So on the time of maintenance estrogen role maintenance of bone, cellular division, heart disease protection, storage and distribution of body fat. So estrogen work then pre-menopause time estrogen level lower ago. Then metabolism கம்மி ஆகும், weight gain இருக்கும், fat abdominal fat அது மாதிரி இருக்கும். So இதெல்லாமே நம்ம heart disease one of the main causes தான். So weight management க்கு என்ன பண்ணணும் பாத்தீங்கன்னா plan for your body's metabolic slowdown, balance your diet balance பண்ணணும். Then intake of fruits and vegetables, fruits and vegetables ஓட intake increase பண்ணணும். Stick to lean proteins like pulses, legumes, adukaprom lean meats அது மாதிரி எடுத்துக்கலாம் protein rich foods. Then choose your whole grains and cereals. Whole grain cereals choose பண்ணும்போது millet based items, then whole grains wheat, then rice, brown rice அது மாதிரி எடுத்துக்கலாம். Then cut back value when reduce portion reduce பண்ணிட்டு food frequency increase பண்ணிக்கணும். So food frequency increase பண்ணும்போது portion size white rice அது மாதிரிலாம் எடுத்துக்கணும். portion size கம்மி பண்ணிட்டு then frequency increase பண்ணும்போது அந்த டைம்ல vegetables or fruits அது மாதிரி எடுத்துக்கலாம். Then beware of health hazards, processed foods, red meat and refined sugar processed meats and tinned items, canned items அதெல்லாமே கொஞ்சம் அவாய்ட் பண்றாங்க. Then dietary strategy for managing menopause. என்னென்ன நம்ம டயட்ல எடுத்துக்கணும் பாத்தீங்கன்னா get enough calcium, enough amount of calcium. ஒரு நாளைக்கு நம்ம தேவைப்படுற ஐட்டம் பாத்தீங்கன்னா calcium பாத்தீங்கன்னா 800 mg. So 800 mg க்கு பாத்தீங்கன்னா dairy products எடுத்துக்கணும். So ஒரு நாளைக்கு about 300 ml of milk, more than 300 எடுத்துக்கலாம், 300 ml of milk. Then pump your iron. So through eating iron resources like green leafy vegetables, dry fruits and walnuts, you can increase your iron. Then take enough fiber source through green leafy vegetables, then vegetables, salads, so fruit salads. Juices are normal vegetable salads and fiber increase. Then eat more fruits and vegetables. Drink plenty of water, about 3 liters per day. Then maintain a healthy weight gain. cut back on high fatty foods. So fatty foods like fried items, processed items, so you have to avoid. Then use sugar, salt in moderation. Salt and sugar எடுத்தாலுமே moderate level எடுத்துக்கணும். So nutrition for women during senior years. Senior year பார்த்தீங்கன்னா after menopause. So after menopause women requirements ரொம்பவே அதிகமா இருக்கும். So what are the requirements na? Same as usual like vitamin D, calcium and vitamin D to prevent osteoporosis. Most of commonly problem enna pathina obesity, undernutrition, osteoporosis, CAD, diabetic and cancer during the old age. So idukla cancer ku pathina high protein diet madiri. So high protein diet la animal as well as plant based la soy product eduthukalam. So soy product weekly twice or thrice, animal based items also twice or thrice anamata. So then what are the foods have to be avoided and food habits to be followed after the 60? Avoid empty calories, eat plenty of fiber rich foods. So fiber rich food edukana constipation avoid pandrathu during old age constipation nariya varukku. So constipation problem avoid pannana andha time fiber adhigama irukku. So plenty of water. So keep hydrated during the 60s. Drink enough amount of water. Pick the food which are low in cholesterol and fiber. So cholesterol kammiyana food eduthukom. Get your vitamins and minerals through fruits and vegetables. So nariya fruits and vegetables eduthukodu namakku vitamins and minerals get. Include more calcium in your diet to overcome osteoporosis and use less salt. Salt usually 60 க்கு மேல பாத்தீங்கன்னா salt restrictions ஓட இருக்கும். So per day பாத்தீங்கன்னா 4 to 5 grams salt அந்த மாதிரி எடுத்துக்கலாம். So salt restrictions ஓட இருந்தா hypertension எல்லாமே கொஞ்சம் பேலன்ஸ் ஆகும். Thank you. Doubt என்ன? Any doubts? So most requirement pathina women's can paakumbodhu calcium and vitamin D and iron with vitamin B12. So folate and B12 pathina during 16 and during teenagers and early childhood la folate requirements irukum. Then old age 20s to 60s pathina calcium requirement, vitamin D and vitamin B12 requirements dame irukum. So food intake edukumbodhu nariya fruits and vegetables plus enough amount of water edukum.
In one slide where the proteins are required, red meat was there in the point, and in another slide it was written be aware of red meat. What is the difference?
Protein is lean meat, not a red meat, it will be a lean meat. So if we are taking as a protein chicken without skin and fishes. Tofu, eating for the salad vandute tofu salad. So tofu salad pathina it's a kind of protein. So protein rich food. So antioxidant adhigama irukum. So like capsicum, onion alla irukilla. So phytochemicals, antioxidant rich food. It's a good source of protein too. So illa cholesterol illa, then fiber, less amount of fiber and less cholesterol and more protein source. So the daily எடுத்துட்டாமே protein non vegetarian எடுத்துக்காங்க இந்த மாதிரி source of protein.
Beyond workout, diet, lifestyle, whatever.
So robotics is also stretching partner.
See, stretching அப்படின்றது வந்து நிறைய பேர் என்னன்னா செஞ்சால் தான் வந்து ஒர்க் அவுட் முடிச்சதா கணக்கு அப்படிங்கிற மாதிரி லாட் ஆஃப் பீப்புள் கிவ் யூ அ நோஷன். சிம்பிள் என்ன அப்படின்னா இஃப் யுவர் மசில்ஸ் பிகம் ஸ்டிஃப் லிட்டில் பிட் ஆஃப் செல்ஃப் ஸ்ட்ரெச்சிங் இஸ் ஆல் தட் யூ நீட். யாரும் பிடிச்சி ஸ்ட்ரெச் பண்ணணும், ஃபோர்ஸ்ஃபுல்லாக ஸ்ட்ரெச் பண்ணணுன்றது இல்லை. சி இப்போ உங்களோட இப்போ நீங்கள் வந்து ஒரு பொருளை இப்போ வந்து பிக்கிங் திஸ் அப், இட் இஸ் பிகாஸ் என்னோட மசில்ஸில் ப்ராப்பரான டென்ஷன் இருக்குது. இப்போது ஒரு கிணத்துல வந்து தண்ணி போட்டு எடுக்கிறீங்கன்னா அந்த டயர் வந்து டென்ஷன் நார்மலாக இருக்கும். ஆனால் அந்த டயரை பிடிச்சி ஸ்ட்ரெச் பண்ணேன்னா இழுக்கும்போது தண்ணி மேலே வராது. ஸோ இஃப் யூ டூ டூ மச் ஸ்ட்ரெச்சிங் தென் த ஸ்ட்ரென்த் ஆஃப் த மசில் இஸ் லாஸ்ட். ரொம்ப ஸ்ட்ரெச்சிங் பண்ணுறவங்க பார்த்தீங்கன்னா அவங்களால வந்து ஹெவி லிஃப்டிங் அப்படின்றது பண்ண முடியாது, என்டியூரன்ஸ் தான் நிறையா. ஸோ இட் டிபெண்ட்ஸ் ஆன் வாட் யூ வாண்ட் டு அச்சீவ். Any other questions? So I saw you with a couple of questions with the doctor and the nutritionist. So first, you are tripping down because of your ankle injury. So there are specific rehabs to improve the stability of each muscle. So for example, ஒருத்தருக்கு வயசாகுது முட்டியில் வலி வருது அப்படின்னா முட்டி தேருது அப்படின்றது எஃபெக்ட். ரூட் காஸ் என்ன அப்படின்னா முட்டியை சுற்றி இருக்கிற மசில்ஸ் வந்து லோடு எடுக்க மாட்டேங்குது. ஸோ அந்த முட்டி மேலே வெயிட் நிறைய வரும். பிகாஸ் ஆஃப் யுவர் இன்ஜுரி பண்ணணும், இன்ஜுரி ஆச்சு அப்படின்னா தே கோ ஃபார் அதர் சர்ஜரி ஆர் தே கோ ஃபார் அ casting பண்ணிட்டு ஒரு 6 weeks 12 weeks based on the type of injury they keep you in a cast. அப்படி வச்சோம் அப்படின்னா the muscles are all getting weak but the ligaments and the joint heal. Okay, well, so that healing has happened. Usually any joint related injury needs 12 weeks of rehab exercises. Rehab exercises na they will use specific exercises to improve the stability of your toe, stability of your shin, stability of your calf. So, நீங்கள் வந்து ஒரு rehab specialist கிட்ட போயிட்டு you find out what is the imbalance you have, எந்த மசிலில் imbalance இருக்குன்னு கண்டுபிடிச்சு அந்த மசிலை strengthen பண்ணிங்கன்னா this thing won't happen to you. Next thing, red meat is not bad, it is very subjective. எல்லாரும் red meat வந்து ஏன் சாப்பிட்றதுன்னா கொலஸ்ட்ரால் அதிகம் அப்படின்றது தானே எல்லாருமே கேள்விப்பட்டிருக்கீங்க. So there is a type of diet called as the carnivore diet which is getting famous in the western world. இது என்ன அப்படின்னா மனுஷன் வந்து when he became a species evolve ஆனப்போ he was only a hunter, he ate only meat. That time he was much more healthier. நம்ம இப்போ வெஜிடபிள்ஸ் சாப்பிட்றோம், ஃப்ரூட் சாப்பிட்றோம்னா இதெல்லாம் அடாப்டேஷன். நம்மளுக்கு ஹண்ட் பண்ணி சாப்பிட்றதுக்கு அனிமல்ஸ் இல்லைன்றப்போ he started surviving on the alternate food. So the system was primarily designed for that. Red meat oda bad rap அப்படின்றது it is not the cholesterol but it has ஒரு inflammatory compound in it. Inflammation na என்ன, இப்போ for example இங்க ஒரு அடிபடுது, பட்ட உடனே அதை ஹீல் பண்ணுறதுக்காக ஒரு வீக்கம் வருது இல்லையா. ஸோ அந்த மாதிரி there are people who have inflammatory marker issue. அதாவது எப்படின்னா இப்போ உங்களோட blood vessels இருக்கு, ஹார்ட் அட்டாக் அப்படின்னோடனே எல்லாரும் வந்து கொலஸ்ட்ரால் ஜாஸ்தியானா ஹார்ட் அட்டாக் வரும் அப்படின்றது நம்மளோட நோஷன். கொலஸ்ட்ரால் ஜாஸ்தியாக இருக்கிறதுன்றது இஸ் த டெர்ஷரி கண்டிஷன். ஃபர்ஸ்ட் திங் வந்து உங்களோட ஆர்டரிஸ் அண்ட் வெயின்ஸோட ஸ்ட்ரென்த் ப்ராப்பராக இல்லை அப்படின்னா, செகண்ட் அந்த ஆர்டரிஸ் அண்ட் வெயின்ஸில் ஏதாவது ஒரு சின்ன இன்ஜுரி ஆர் இன்ஃப்ளமேஷன் இருந்ததுன்னா அந்த இன்ஃப்ளமேஷன்னால உட்கார அந்த கொலஸ்ட்ரால் தான் கெட்ஸ் solidified and creates a block. So cholesterol அப்படின்றது is not a bad thing altogether, but இந்த ரெண்டு precondition meet ஆச்சு அப்படின்னா, ஸோ ரெட் மீட்ல இந்த இன்ஃப்ளமேஷன் மார்க்கர் ஜாஸ்தியாக இருக்கு அப்படின்றதுனால உங்கள் ஃபேமிலியில் ஹார்ட் ரிலேட்டட் இஷ்யூவோட ஹிஸ்ட்ரி இருந்துச்சு அப்படின்னா ரெட் மீட்டோட அளவை கம்மி பண்ணுறது நல்லது. இட் டஸ் நாட் ரிக்வயர் யூ டு completely avoid 100 or 200 grams சாப்பிட்றதுனால you don't get so much of inflammation. பிரச்சனை எப்போ வரும் அப்படின்னா, இன்னைக்கு மட்டன் பிரியாணி அப்படின்னு 2 கிலோ மீட்டை ஒருத்தர் உட்காந்து சாப்பிட்றாருன்னா that triggers inflammation. So red meat is not bad altogether, it is subjective. அதே மாதிரி இந்த வைட்டமின்ஸ், மினரல்ஸ், இந்த மைக்ரோநியூட்ரியன்ஸ் எல்லாம் வந்து இவ்வளோ MCG, இவ்வளோ mg, it is not practical to see all those and eat unless and until everything comes in a pill form. The basics of dieting enna appadina I will call it your area specific nutrition. இப்போ மாம்பழம் வந்து வெயில் சீசன்ல வருது, is it healthy or not healthy? Watermelon comes in the summer season, is it healthy or not healthy? Nature knows best. இந்த ஏரியால நமக்கு தேவையான மாதிரி எந்த நியூட்ரிஷன் இருந்தால் we will be able to survive better அப்படின்ற மாதிரி தான் the seasonal vegetables and fruits are coming. So உங்களோட டயட்ல first and foremost you should include any of the seasonal fruits and vegetables. Number one. Second, பயங்கர பிரைட் கலர்ல இருக்கிற ஒரு டொமேட்டோ சமையல் எடுத்தீங்களா, இல்லை ஆரஞ்சா ஒயிட்டா க்ரீனானே தெரியாத ஒரு டொமேட்டோ எடுத்து சமைக்கணும். Obviously the one that is bright. So that is also our instinct. Each color signifies few micronutrients. So bright colors, minimum 3 vegetables, so fruits, so on diet and daily safety. Every day you keep rotating the vegetables and color, you will not have any protein or micronutrient deficiency at all. And one more thing, a woman requires 36 grams of protein is a RDA recommendation. Okay? So RDA minimum requirement to survive. நம்ம வாழ நினைக்கிறோம், ஓகேவா, நல்லா வாழ நினைக்கிறோம், வாழ்ந்தா போதும் அப்படின்னா இப்போ நான் என்கிட்ட சாப்பிட்றதுக்கே வழி இல்லை, அப்போ அந்த 36 கிராம் மட்டும் நான் சாப்பிட்டேன் அப்படின்னா என்னால் உயிர் வாழ முடியும் அப்படின்றது தான் அந்த 36 கிராம். நான் நல்லா வாழணும் அப்படின்னா ஐ நீட் மோர் ப்ரோட்டீன் அப்படின்னு ஒன்று எவ்ரிபடி திங்ஸ் மசில்ஸ் ஆர் ப்ரோட்டீன், யூ ஆல் நோ தட். உங்களோட ஹார்ட், லங்ஸ், liver, kidney, all these are also protein. Protein இல்லாமல் அது கிடையாது. They are the building blocks. இப்போ எக்ஸசைஸ் செஞ்சா புரோட்டீன் நிறைய சாப்பிடணும் அப்படின்றது காமன் சென்ஸ், எல்லாரும் பேசணும் இல்லையா? உங்கள் ஹார்ட் வேலை செய்யறதை எப்பயாவது நிறுத்துதா? உங்கள் லங்ஸ் எப்பயாவது வேலை செய்யறது நிறுத்துதா? கிட்னிஸ் எப்பயாவது வேலை செய்யறது நிறுத்துதா? They work 24/7, which means இந்த 36.6 grams of protein is necessary for a woman who is 45 to 50 kgs in weight for survival. ஒரு ஆக்டிவாக இருக்கீங்க அப்படின்னா you need more. So basic protein requirement அப்படின்றது இப்போ ஒரு நாளைக்கு நீங்கள் 3 வாட்டி சாப்பிட்றீங்கன்னா உங்களோட கையில் இந்த சைஸ் அளவு, மேபி டோஃபு, மேபி பன்னீர், மேபி சனா, மேபி மட்டன், மேபி சிக்கன், மேபி ஃபிஷ், அந்த அளவு போர்ஷன் 3 வாட்டி ஒரு நாளைக்கு சாப்பிட்டீங்கன்னா then you will get the basic requirement of protein. ஏன் இந்த கையளவு அப்படின்னா ஒருத்தர் குண்டாகிறாங்க அப்படின்னாலும் சரி, ஒல்லியாகிறாங்க அப்படின்னாலும் சரி, the size of the palm dimension changes. இந்த திக்னஸும் இந்த ஓவரால் சர்க்கம்ஃபரன்ஸும் மாறும், which is an indicator. இப்போ உங்களோட ஹார்ட்டோட சைஸ் என்னன்னா க்ளோஸ் டு திஸ் சைஸ் அப்படின்றாங்க. So the same way the food can be measured easily like this. ஸோ அந்த அளவு ப்ரோட்டீனாவது உங்களோட டயட்டில் ஒரு 3 வாட்டி ஒரு நாளைக்கு எடுத்தீங்கன்னா then your protein requirements will be met.
So if you overcome to weight loss or weight gain, there are different reasons. இப்போ சில வீட்லேயே அவங்க ரெமெடி எடுக்கலாம்னா இப்போ யூடியூப்ல நிறைய வீடியோ வருது, இதை நீங்கள் குடிச்சிங்கன்னா எப்படி ஆகலாம், லேட்டஸ்ட் எக்ஸசைஸ் இது பண்ணால் எப்படி. ஸோ நான் இப்போ வெயிட் லாஸ் பண்ணணும்னா ஃபர்ஸ்ட் எனக்கு எதனால வெயிட் கெயின் ஆகுதுன்றதை நான் ரிசர்ச் பண்ணிட்டு அதுக்கப்புறமா தான் பண்ணணும்.
எக்ஸாக்ட்லி. இப்போ யூடியூப்ல காட்டுற மாதிரி நான் இப்போ ஒரு யூடியூப்ல போறீங்க அப்படின்னா இதை டெய்லி சாப்பிடுங்க, ஒரு நாளைக்கு 1 கிலோ குறைக்கணும். ஜீராவை போடுங்க, லெமனை போடுங்க, பனியை போடுங்க, இதை டெய்லி காலையில் குடிங்க, 10 நாள்ல 10 கிலோ. செய்யறவங்களோட வாழ்க்கையில 2 கிலோ கூட குறைச்சிருக்கணும். ஹியூமன் மென்டாலிட்டி, நான் 1 மணி நேரத்துக்கு 1 மணி நேரம் டெய்லி நடங்க, ஹெல்தி ஆகுங்க, டெய்லி ஒரு 50 கிராம் குறையும் அப்படின்னா 50 கிராம் தான் குறையும். இந்த சேனல் டெய்லி 1 கிலோ என்ன பண்ணணும்? எதுவுமே பண்ணணும், இதை குடிச்சா போதும். அதை குடிச்சிட்டு 4 முழுக்க பட்டினி கிடந்தா 1 கிலோ குறையும். Okay, well, so all these things that you see, if YouTube was an university, we all would be walking like the top models on this planet. YouTube channel, calories. It is either our bad lifestyle that gives high stress, improper sleep because of which you are not able to regulate the hormones in the body. Third thing, இது ரெண்டுத்தினால you end up overeating. To balance stress. Eating is not the root cause. The root cause is elsewhere. நம்ம என்ன ட்ரை பண்ணுறோம்? இப்போ எனக்கு let's say ஒரு IT ப்ரொஃபஷனல் இருக்காரு, ஒரு நாளைக்கு 16 to 18 hours அவர் ஆஃபீஸில் 12 மணி நேரம் ஒர்க் பண்ணாமல் he is taking calls in the morning, taking calls in the night, ஃபேமிலிக்கு டைமே ஸ்பெண்ட் பண்ண முடியறதில்ல, வீக்கெண்ட்ஸ் கிடைக்கல. திஸ் கை இஸ் இன் ஹை ஸ்ட்ரெஸ் என்வாரன்மெண்ட். இவருக்கு நான் ஒரு டயட் கொடுத்தேன் அப்படின்னா நான் என்ன சாப்பிட்றேன்றதே ரியலைஸ் பண்ண மாட்டார். ஸ்ட்ரெஸ் ஆகும்போது வாட் எவர் ஹி கெட்ஸ் இஸ் கோனா ஜஸ்ட் கிராப் அண்ட் ஈட். த ஸ்ட்ரெஸ் இஸ் த ரூட் காஸ். இதே அவரோட லைஃப்க்கு ஒரு 1 month வெக்கேஷன் எடுத்துட்டு இஃப் ஹி ஸ்விட்சஸ் ப்ரொஃபஷன் தென் ஹி வில் பி ஏபிள் டு லூஸ் வெயிட் ஈஸிலி. நம்ம என்ன பண்ணுறோம், 18 hours ஆஃப் ஒர்க் கால் இதுக்கு நடுவில் ஓகே ஐ வில் ரெடியூஸ் மை கேலரிஸ் டு 1200 நான் வெயிட் குறைச்சிருக்கேன். இல்லை, ஸ்ட்ரெஸ் ஜாஸ்தியாகி 10 நாளில் ஒரு 3 கிலோ குறையும். அதுக்கப்புறம் யூ வில் எண்ட் அப் ஈட்டிங் மோர், which is a bad idea. You have to fix the root cause, not the symptoms. Questions? Anything else?
So protein வந்து weight வேணும்னா 72 grams protein.
72 72 grams கிடையாது. See, weight, the 72 grams is a starting point for your requirement. Okay, for example, என்னோட வந்து பார்த்தீங்கன்னா I work with one patients who have undergone heart surgery, chemotherapy, blah blah blah. The other side is models, bodybuilders, weightlifters and fitness athletes. இப்போ இவங்களோட சைடில் பார்த்தீங்கன்னா I'll be giving, let's say, 1 gram of 1 kg of body weight 1 to 1.5 grams of protein கொடுக்கலாம் based on their metabolism. அவங்களால எவ்வளோ ஃபுட் அப்சார்ப் பண்ண முடியுது, அவங்களால எவ்வளோ சாப்பிட முடியுது. Some people will not have the eating capacity. அவங்க வந்து இவ்வளோ கிராம்ஸ் தான் சாப்பிடணும் அப்படின்னா that becomes a torture. You have to slowly start. அப்போ if the person is 70 kgs, I will start at 70 grams of protein a day and based on how he is responding, how he is recovering, how he is performing, slowly I will increase it. If it is a weightlifter or an athlete or a bodybuilder, the starting point will be 2.5 grams per kg. The level of activity, your goal, the food absorption power, இது மூணுத்தையும் வச்சு then we calculate. So அதனால தான் நான் வந்து I try to simplify things. Your palm size 3 times is going to give you the basic requirement of protein to be healthy. Then if you are working out for 1 hour extra நீங்க work out பண்றீங்க அப்படின்னா around the workout increase some 15 to 20 grams of protein. That would be the second step. So உங்க recovery நல்லா இருக்கும். அதுக்கப்புறம் slowly you will have to work your way around.
72 grams is less.
72 grams is less or more, that is the starting point. Starting point. அதுக்கு கம்மியா போனீங்க அப்படின்னா your recovery will be very tough. If you have a specific fitness goal.
What is the time interval between post-workout and the working you can have?
See, usually I will allow people to eat immediately after workout. ஏன் அப்படின்னா, see, when you are working out, the first thing that gets exhausted is the energy inside your cells. Okay, well, that time your cells are like dry sponge ready to absorb whatever comes in. That time, if you are giving the body good quality nutrition, it can have good amount of carbohydrates, good amount of protein, everything gets absorbed into the cell easily, and the chances of wastage of food is less. For example, in the lunch வந்து சாப்பிட்றீங்க, breakfast வந்து சாப்பிட்றீங்க, post workout வந்து சாப்பிட்றீங்க, dinner வந்து சாப்பிட்றீங்க. எந்த மீல் மேக்ஸிமம் அப்சார்ப் ஆகும்னா the first would be your post workout meal. The second best absorbing meal will be your breakfast because நிறைய நேரம் ஃபுட் இல்லாமல் இருந்துட்டு நம்ம சாப்பிடுவோம். So ideally I say if you finish your workout you can immediately have it. The time interval is next 45 minutes to 1 hour is the best time where the absorptive power is very high, within 45 to 1 hour.
So in that case we can take a lot of fibers and proteins.
See, I wouldn't recommend much fiber. See, when I say the body is ready to absorb everything into the cell, fiber is something that our body does not digest. It utilizes and eliminates. So fiber வந்து they say fiber வந்து people see it as only like filling of the stomach, and all those things. Fiber or primary function என்ன அப்படின்னா, let's say in your dinner you take fiber. Okay, there are soluble fiber, there is insoluble fiber. Soluble fiber அப்படின்றது it gets mixed in the blood and it gets attached to the LDL or the bad cholesterol as we call it in the liver, and then is pushed into the intestine and next day morning is eliminated. So that is the most important function of soluble fiber. Insoluble fiber builds up bulk in your intestine so that your excretion happens without any trouble. For an average individual needs 25 to 30 grams minimum for these two processes to happen well. And fiber reduces the speed of food absorption, which is good for your breakfast, lunch and dinner, but not ideal for your post-workout where you are trying to push everything into your muscle.
What can you do?
I would say some protein and carbohydrates. It would be great if you guys can keep the phones in off. So, sorry. Embarrassing.
I mean, what kind of food you can take?
Post-workout would be predominantly, let's say if you are someone who craves for rice, if you are a non-vegetarian, you can have some chicken or fish along with rice, or maybe eggs. If you are a vegetarian, some tofu or paneer along with some rice, that would be one. If you are not craving for rice, the primary thing would be the protein source along with a small piece of fruit.
The pre-workout.
Pre-workout, I would say just have a coffee. That's the ideal thing. See, when you are working out, there are two ways of working out. One, you are trying to burn. The second is you are trying to gain. If you are trying to burn, fuel போட்டுட்டு அதை burn பண்றது is just going to burn the fuel. When you are going empty, you are burning the fuel inside the muscle, and post 20 minutes of your session, you start tapping on the reserve energy, which is your additional fat. So it's ideal to just have a cup of black coffee or black tea and get into your workout, finish, and then have your maximize for fat loss. I ask people to work out first thing in the morning and then have their breakfast and post workout as a single meal. Improves your results.
So what's the good time to work out?
First thing in the morning is the best time for two reasons. One, your fat loss potential is going to be high. And number two, during the day, whatever work comes, you will not skip your workout. So on the consistency one, that is one part. If you look at it on the other way, if your profession demands early morning work, then what is the time that you can work out regularly? For example, like I was working for a company called PayPal and my work will end at midnight 12. Okay, and then next day morning I will be going back to office at 8. So 12 o'clock is when I drive to the gym in the night. I worked out every day and I was seeing considerable improvement. Okay, so first thing that is required is consistency. If you have time, first thing in the morning is best, or based on your like lifestyle, pick up one time and be regular on that time every day.
So one last thing, healthy weight loss and non-healthy, because I've seen people changing their lifestyle and becoming very skinny, like turning into vegan and becoming skinny, but still they are healthy. But otherwise, like they are skipping their food and becoming losing their weight and end up heavy. Right now they don't see any changes, but I have a doubt, like will they pick in any diseases or will they lose a lot of
See, you are talking about fasting, right? A little bit about fasting, yes. So, first and foremost, in my humble opinion, vegan is not healthy. Okay? For example, now vegan protein சாப்பிட்டேன். Okay. What is protein? A combination of amino acids. Let's say you know the vegan protein, the soy protein, சாப்பிட்றீங்க, peas protein, சாப்பிட்றீங்க. All these are deficient in essential amino acids, 1 or 2. Essential amino acids there are over 20 amino acids which combine to form protein. அதில் 9 amino acids நம்ம பாடியால் மேனுஃபேக்சர் பண்ண முடியாது. இந்த 9 amino acids தர food தான் complete protein. For example, peace protein is the latest trend. இப்போ வந்து Arnold is also propagating vegan. Arnold is vegan, நீங்களும் vegan ஆகலாம் அப்படின்னா Arnold is saying most of my meals are vegan. He still has eggs for breakfast. He still has steak for lunch. 80% of my food is coming from vegetarian source, so I am vegan. So that is a healthy vegan. If you are talking about peace protein, methionine or essential amino acid, it is close to 0. Peace protein, my recovery is not going to be complete. My muscle growth is not going to be complete. If I mix rice with peace protein, then I get methionine, but at the cost of additional so much extra food. Okay, so vegan is not healthy. That is one. Second thing, weight loss is unhealthy. What you need to focus is fat loss. The problem we all have is that extra flap of skin that is hanging. But the internet has made you believe standing on the scale and seeing a number is important rather than looking at yourself in the mirror. Let's say, like you're going to a party. Wow, you are only 49 kilos in Sulwanga, or wow, you look slim in Sulwanga. We have changed the way the human mind and recognition works, and we are looking at a number. When you start chasing a number, you will do a lot of stupid things. Inevitably. So number is not the thing. When you see the mirror, there should be no extra flab. The process is going to be slow. I can, for example, when athletes, fighters, weightlifters, bodybuilders, when we have to get to a contest, last 3 or 4 days, I have dropped up to 10 kgs to fit into a category in 3 days, which could be the height of unhealthy weight loss. It is very much possible. That's what many people try to do. But to get into the shape to compete, I had to diet and work out for 6 months. So that is the long-standing thing. So the goal it could be in terms of whether I could run for 1 hour or whether I could climb 10 floors without panting for air. If I look at myself in the mirror, I don't have extra flabby skin. If I look at the mirror, my skin is clear. If I look at the mirror, I like myself. That is the goal that you have to focus, and you need a balanced nutrition. And when it comes to fasting, it's not bad, but it has to be, for example, when the human, let's say the typical South Indians, we never had the concept of breakfast. We had a lunch, we had a dinner. There was a snack. Our eating window was between 10 a.m. in the morning and 5:30 or 6 p.m. in the night. Sun up to sundown. That was our eating pattern. When we start eating late in the night, the hormone balance gets skipped, and that is that many people gain weight. So fasting, your system needs 12 to 14 hours of rest to digestive system. That happens if you eat only between sun-up and sundown.
Intermittent fasting.
Intermittent fasting is this concept, but enforced by the Westernisms. 8 hours சாப்பிடுங்க, எந்த 8 hours வேணா சாப்பிடுங்க அப்படின்றது. Yes, it does help, but if you are planning sun up to sundown, you are optimizing your system. Because நம்ம எல்லாருக்குமே the circadian rhythm is encoded. Okay? We are not nocturnal. We are active during the day. Sunlight is our source of activity. So on the time that if you are feeding yourself, and don't feed yourself when the sun goes down, you will not only lose the extra fat, but you will improve the longevity of your life. Yeah? Any other questions?
different sugars avoid பண்ணணும்.
சுகர்ஸே தேவையில்லை.
Brown sugar கூட தான்.
ப்ரௌன் சுகருக்கும் ஒயிட் சுகருக்கும் என்ன வித்தியாசம்?
Or processed sugar.
This process is not 100 grams to 99 grams of sugar is white. 98 to 97 grams is your brown. Doesn't make a huge difference. See, sugars, sweets and all these delicacies happened in our life once in 2 or 3 months when there was festive occasion. Regular yaar weekly irundhathu kedaiya, but over the past 200 years it became regular weekly. Even rice was not a regular staple food every day in the South Indian household. It is our laziness that has brought in easier cook avudhu other daily saapidalama into vandadhan is excessive carbohydrates in our diet, excess sugar in our diet. If you avoid sugar, see, for example, like my wife did 21 days without sugar, which means anything that has added sugar she didn't take. She was eating fruits and other things which had a natural thing, okay? She did not do any kind of exercise. She did not try to reduce her food intake, but still she dropped 2 inches around her waist in just 21 days of dropping sugar. She did it for a religious purpose, okay? But still, so that's what sugars do for waste. Overall, sugar is the trigger for your unhealthy gain.
So we should not take any form like honey.
Avoiding sugar is the best thing. See, honey you can take a little bit, but நிறைய பேர் பண்ற தப்பு என்னன்னா they heat honey. Honey should never be heated. Even in Ayurveda, honey is given first thing in the morning. எல்லாரும் அந்த weight loss அப்படின்னு propagate பண்றாங்க. That is not the case. Salt, honey and water helps you move the bowel very easily. In warm water, not hot water. Honey in hot water turns toxic. Yeah. Okay, next week I won't be available. I have an event in Coimbatore. So a person from my team called as Manish will come and conduct a class. Yeah.
Thank you.